Greetings and welcome everyone to today's Wear Pink Day conversation in observance of Breast Cancer Awareness Month. My name is Lisa Payton, founder, CEO, and president of the Foundation for Black Women's Wellness, where we energize, mobilize, and support women to transform their health and their lives through education, advocacy, leadership development, and powerful partnerships. I am so happy to be here today, joined by my colleague and co-host Christine Russell, our Director of Health and Wellness Programs, along with several expert guests who we will hear from very soon. Join me in welcoming Gail Johnson, Director of the Wisconsin Well Woman Program, Nurse Bonnie Anderson, a previous president of the Wisconsin Breast Cancer Coalition and current after breast cancer diagnosis mentor, and Monique Harris, breast cancer survivor, artist, herbalist, doula, and Well Black Woman Institute fellow. Thank you so much, ladies, for joining us today. As you all know, improving the health and the lifespan of Black women is core to the work of the foundation and why we exist. And education and awareness is such a vital part of achieving that vision for every Black woman. For the past 10 years, we've educated women on breast cancer prevention and survival, and we provide a plethora of services for women across our community and state. And we continue to do that vital work as breast cancer continues to pose one of the greatest threats to Black women's health and all women's health in our community, our state, and our nation. In fact, cancer is the second leading cause of death in Wisconsin and Dane County behind heart disease. And like many of you and the women that we serve daily, I've had my own breast cancer scare just a few years ago that I've spoken about often that led me to a series of tests that thankfully resulted in a negative test result. But that is not always the case. And we know that for Black women, too often that diagnosis comes with fatal news. And so our goal is to prevent that, or at minimum, to support women when they get that news. In fact, we know that breast cancer disproportionately impacts Black women. We have a slightly lower incidence of breast cancer compared to our white peers, but a significantly higher mortality rate. And according to the American Cancer Society, in 2024, an estimated 40,530 cases, new cases of breast cancer, are expected in Black women, and 6,170 deaths are predicted. That means that Black women are 38% more likely to die from breast cancer than white women. But we believe that education and prevention saves lives and increases survival. And we're here today with the spirit and the intent to save lives because we don't claim those statistics, we claim life. And we're here with our guests today to talk about that. So, as sisters, as we empower ourselves and others to take action and to prevent and survive breast cancer and to get the care that we deserve, we have this wonderful lineup. And let's start discussing that and the importance of prevention and how we access the services that we need that are crucial for equitable access to breast cancer screenings and other support. And to bring us into that discussion, we welcome Gail Johnson, again, Director of the Wisconsin Well Woman Program. Welcome, Gail.
Thank you so much, Lisa, and I'm looking forward to, talking with obviously our audience as well as our the other panelists.
Absolutely. So, Gail, tell us a little bit more about the Wisconsin Well Woman Program, what it provides pertaining to breast cancer prevention and survivorship, and how viewers can gain access to this critical resource.
Well, first of all, the Wisconsin Well Woman Program is our state's component of CDC's National Breast and Cervical Cancer Early Detection Program. And basically, what that means is there is a program like ours in the other 49 states, the US territories, and there, I believe, are 12 tribal nations across the country now that are also a part of the national program. And so there are about 68 um, programs across the nation. And with the Wisconsin Well Woman Program, we've been providing services now since 1994. And in that time, we have provided services to more than 86,000 Wisconsin women. And here in Wisconsin, just so you know a little bit about the program, um, we are looking at women whose income is at or below 250% of the federal poverty guidelines. We don't have any co-payments or anything for the program. If you are uninsured, and the majority of clients and women who come to us are uninsured, you know, um, you are eligible for the program with your 250% of the federal poverty guideline income. But the other thing to keep in mind is, as a breast and cervical cancer screening program, and we are focusing obviously today on breast cancer, there is no payment for our services. We have well woman providers. We have 40 organizations across the state. So regardless of where you live in Wisconsin, you may access the program. We have a coordinating agency for every county in Wisconsin, and that coordinating agency helps you with enrollment. They help you to identify the providers in your community who are a part of our program. They help you schedule appointments. So we provide what we call service coordination, because we definitely want to make sure that everything that we have to offer, you know about. Okay. The other thing is that we have a treatment component. So if you are diagnosed with breast cancer and you need treatment, our treatment component is called Well Woman Medicaid. And that is because it is the Medicaid program, the Division of Medicaid Services here in Wisconsin, or the Wisconsin Medical Assistance Program, or Wisconsin Medicaid program. That's how a lot of people know it. They are the ones who provide the treatment component for women in our program who are diagnosed with breast cancer and who do not have treatment resources. So, and again, we have a you can go to our website, Well Woman, to see who the coordinating agency is in your area. We think that it is important that even if you don't need our program, if you've got friends, if you've got family members, share our information with them. Um, you can call 1-800-642-7837 if you are not a web user, or if you just want to use the phone and contact us. And again, you can work with the coordinating agency in your area to help you enroll in the program and get what you need. And I should make sure that you understand we provide the screening and diagnostic services.
Mm-hmm. Thank you so much, Gail, for that vital information. And I'm a witness, as is Christine, for how often we have been able to refer women to the Wisconsin Well Woman Program. So I want to thank you and the agency and you personally, because I know because of you and your team, we have been blessed to have this resource in our state for several decades now, and it is benefiting and saving lives of women in our state. We're a witness to that. Can you break down a bit about what makes someone eligible to be able to partake of these services?
Oh, that's an excellent question. First of all, if you have absolutely positively no insurance, okay, so you are uninsured, that's the first thing. If your income is at or below 250% of the federal poverty guidelines. And again, when I talked about the coordinating agencies a minute ago, when you go to our coordinating agency in your area, we have a one-page enrollment form. That's one of the things I love, is one page. We're going to ask you, obviously, your name, what your Wisconsin address is. We're going to ask you whether or not you have insurance, because a small number of women who come through our program do have insurance, but they may have a high deductible or a high copayment. As long as their income is still within 250% of the federal poverty guidelines, though, they are eligible for the program, but the majority of women who are part of the program have no insurance. That's the big thing. Okay. And again, like I said, a one-page enrollment form, very simple. And you complete that. And then again, the coordinating agency will say, these are the providers, the Well Woman Program providers in our community. Would you like to schedule your appointment, or I can, schedule your appointment, or I can help you schedule your appointment for, going and getting a mammogram with one of the Well Woman providers. But again, the big thing to remember is really if you have absolutely positively no insurance. And again, that's the number one thing that we hear. I have no insurance, um, and I need services.
That's so important to pull out, Gail, as we know that Black women in Wisconsin are more likely to be uninsured or underinsured than other groups, and having access to care is absolutely critical to be able to combat breast cancer or any other chronic or life-threatening disease. So hopefully our audience is hearing that loud and clear. One question for you, Gail, for Black women who are insured, who do have access to basic services, because we know that income is not a protective factor for Black women when it comes to breast cancer. Any advice on how to direct those women to find additional supports that they may not find through their insurer?
I always like to point out the American Cancer Society. I also like to point out that we have several, and hopefully our colleague Bonnie will talk a little bit about this, but we have several support groups in the African American community, especially in southeastern Wisconsin. And one of the things that I have found is that many women who have gone through breast cancer themselves, many times are the best advocates for who they have worked with to help them to get to where they are. The American Cancer Society, the other thing that is important is, again, in terms of the community organizations, is one of the things that's happening now is a lot of our, not only just your community organizations, but our faith-based organizations are providing education, especially in October, on the importance of not only getting the clinical services that you need, but they may also talk about who can help when you need help outside of even the clinical services, because that's the other thing. We have found with the Well Woman program, many times women need transportation to get the clinical services. And so we have quite a bit of education in the community, especially in southeastern and in southern Wisconsin. And and again, the American Cancer Society, and I can't speak enough about how important these resources are.
Absolutely. Thank you so much, Gail. And we'll circle back at the end to ask one more question about the Well Woman program. But of course, we want the audience to know you can always also call the Foundation for Black Women's Wellness. Christine manages our wonderful Cancer Thrivers support group, which includes breast cancer survivors and thrivers. And that's always a resource. And of course, we are here to help coordinate many services, including transportation, housing, and other pieces that our community health worker team is standing ready always to provide to women in need. With that, I'll turn it over to you, Christine.
Thank you so much, Lisa. And thank you, Gail, for the work that you're doing for this community, changing lives. 86,000 lives touched is so powerful. So thank you for what you do.
Thank you.
Absolutely. So, in addition to screenings, Nurse Bonnie, can you help us understand, tell us a little bit about yourself, and then help us understand what prevention really looks like for Black women, and what are some of the most important steps that we can take, especially if we have a family history of breast cancer?
Okay, yeah, thanks you so much for having me. My name is Bonnie Anderson, and I am a 32-year breast cancer survivor. When I look at prevention from breast cancer for African American women, what I think is important to remember that we can't stop ourselves from getting breast cancer, because it's all breasts are made up of cells, and sometimes those cells just go crazy. But what we can do, hopefully, is prevent death from breast cancer by trying to make sure we are diagnosed early, that makes sure that we're doing what we should do. And I think sometimes with African American women, we don't get regular checkups, and we should. That's one thing that we should be doing every year: regular checkups. It's hard to maintain a healthy body weight, but we should at least work on maintaining a healthy body weight. Exercise regularly, limit alcohol, because what they're finding is even moderate use of alcohol can cause problems for breast cancer. And try to eat a balanced diet. One thing we have to do is also know our family history. I think we need to know our family history for whatever disease that we may come upon us. We should know family history, because we have to keep in mind that most breast cancers, I think about 75 to 80% of breast cancers, there is no family history. So we have to, as African American women, we have to be diligent when it comes to some of these things, checking ourselves monthly, making sure if we don't know how to check ourselves, find a program in your area. We're not Nurse Affecting Change. We're out in the community every Saturday doing clinical breast exams in the community, and we teach women how to take care of themselves, how to check themselves monthly. The other thing we need to do is make sure that we're having a clinical breast exam once a year. If we're going to our doctors for a physical and he doesn't check your breast, he's doing the echocardiogram and all those things, and he doesn't check your breast because he's not comfortable, ask him, can he have his nurse come in and show you how to check your breast, because you should have a clinical breast exam once a year. And if you're over the age of 40, I think the American Cancer Society is saying over the age of 45 because of the United States Task Force stuff. I don't agree with that. I think an African American woman should have a mammogram starting at age 40. If she knows she has a significant family history, she should talk to her provider and have a mammogram even earlier. But there's so many things in our community that women can access, along with what Gail is doing. Gail is wonderful. Thank you so much, Gail. But there's so many things in our community that happens. As I said, Sisters Network is always doing a program to educate folks. ABCD is there for you if you are unfortunately diagnosed with breast cancer. And we have Oza Homes African American Breast Cancer Support Group if you're unfortunately diagnosed with breast cancer, because what we do there is make sure that once you are diagnosed, that you are taken care of properly, because there's so much systemic racism as it relates to taking care of all African Americans. So we make sure that if the woman is coming to us and she thinks she's having problems with that, we go to doctor's appointments with them and those kind of things.
Absolutely. Nurse Bonnie, you raised so many important things. And one of the things that we heard you raise is self-advocacy, the things that we need to know walking into our clinical experiences, what we need to understand about the steps, the screenings, monthly self-breast exams, clinical breast exam annually, and how to talk with our providers. And a piece of that we strand out is, are you happy with that provider? Are you getting advice? Are you getting the attention that you need? Are your concerns or your symptoms being taken seriously? It has not been unusual for us to work with women who come to us who say, I went to one physician and I asked and said something was wrong. They missed it. I went to someone else and they found it. And there was a year between these two incidences. And so timely diagnosis, if we're doing our part to keep those medical appointments, right, that is critical. And we know that there's trust in our experiences in medical and clinical settings is often the reason why we don't keep those, timely appointments. So what more can you say about the importance of that self-advocacy?
Well, as it relates to things like genetic testing, all too often women are diagnosed with breast cancer, and sometimes we're not armed with the information we need before we go.
Mm-hmm.
If you are diagnosed with breast cancer, I think you should try. Sometimes it's hard to track family history because sometimes African Americans are really private and don't talk in their family. But ask your doctor, should you have genetic testing? Should you consider it? Because all too often we may have the BRCA1 or BRCA2 gene. So you want to make sure, just ask and take someone with you. Take someone with you, because you may not have the questions that you need to ask, and they may have, and write things down. Write things down. If your oncologist or your doctor is not asking you, would you like genetic testing? Ask them, would you benefit from it? Do they think you need it? And then do your own research. Do your own research, because it's very, very important, if you do have a family history, that you have genetic testing. You should be asking the right questions.
Thank you so much, Nurse Bonnie. This was very helpful. Lisa and I are sitting here taking notes ourselves. So important to make sure that we are armed with the information from our family history. And if not, to pick up the phone and to make those calls.
Right.
Call aunties and uncles, call our grandparents, call our family members to make sure that we have a clear understanding and then document that for future generations.
Yeah.
Because just because we're making the phone call for our own health, we need to make sure it's documented in a safe space and shared with the family holistically, so we can change the trajectory of this family behavior.
And just be more open. If we could just be more open in our families to ask the right question, because so many of us don't know what Aunt Mary died from, and so many of us. But I think sometimes we ask the right question, we may get the right answer.
So powerful. Thank you so much. Now, Monique, coming to you as a Well Black Woman Institute fellow, a doula, and herbalist, and also a survivor of breast cancer. Monique, looking back, can you share what is one thing that you wish you would have known prior to your breast cancer diagnosis?
Um, it's like Bonnie said today. I wish I would have understood that my daily habits really played a big part in my health. I worked hard helping everybody around me, working two, three jobs, never sitting down really to take a break or uh putting my needs like on the back burner, the stuff that I should be doing for self-care, I was not doing. I didn't exercise. I ate what I wanted, you know, things that say right on the bottle, it may cause cancer. I would still use it,
Yeah.
even though I'm knowing that I don't have the healthiest habits, right? I was able to recognize when I got diagnosed that it was a gift and a curse because it allowed me to rest. It gave me an opportunity to sit down and kind of pause. I had to give everybody their stuff back and let them carry their own weight so that I could just take care of myself. And that was a big part of me getting some rest, you know. So although I don't want to say I lost my business. I stepped away to take some time away when I was healing. So I stepped away. I stopped doing that. I lost my hair, my eyebrows, my eyelashes, my toenails, my fingernails. When I say God stripped me of everything, I mean everything. My confidence was, you know what I mean, in the toilet because of all the things that you know what I mean, well, it could have been recognizing all the things that I was losing, but because I was able to recognize that God was breaking me down to kind of build me back up. I went into it with the attitude of getting through it, right? So I spent most of my time like still encouraging women, still uh doing the things that was necessary on my end. I didn't look like I had cancer. If you didn't know, if I didn't say it to you, then you probably wouldn't guess that I did. My family didn't know when I was going through or when it was kind of taking a toll on me because I still showed up. I still had a positive attitude because I knew I wasn't going to let this cancer thing take me over. And I knew that my attitude had a lot to do with how I would heal. But today, my habits look different. My habits look like I'm exercising daily. I'm taking my time to rest. I know how to step away from stuff that's not for me. And I'm not trying to save everybody. I'm trying to save me. So that looks different. And with me saving me, I still can support the other people around me, but I can't put myself on the back burner to do it because I don't want to be the reason that my chances are higher of the cancer coming back, if that makes sense.
It absolutely does. And I resonate with that so deeply. I know many of our listeners resonate with that so deeply. And I think these are words to live by now. These are changes that we can make now before we get the diagnosis, before we get that bad news from the doctor. take it from us, take it from those of us who have lived this life, is that now is the time to make the change. It's not too late. And I honor you, Monique. I honor your story and your resilience. You said you wouldn't know that I had cancer because I was always showing up, right? Because that felt good to you, right? Some people are saying it's okay to sit down, but that felt good, that felt right. And I appreciate you for honoring your body and listening to your body.
And can I just say something? And if or when you're diagnosed with breast cancer, it is so helpful. And I think sometimes we don't, but it is so helpful to have a mentor, someone who's been there, done that, who can help you, who can empower you to take better care of yourself. And again, ABCD does that, set you up with mentors. But it helps. It really does help, because sometimes your family don't know what you're going through. Sometimes your husband don't know what you're going through. But if you talk to a person who's been diagnosed, been there, done that, that person could really see you through your journey.
Absolutely. I want to echo what Christine said. Just it's an honor to be able to speak with you, Bonnie and Monique, today, that you're here to tell the story and to educate. It's a witness to the fact that we believe that breast cancer is not a death sentence. It should not be. It will not be. We believe in claiming our intentions. And here is living proof on this call that it's a beatable disease, but it's all about detection early. And before that, preventative steps. I really appreciate what you said, Monique, about not realizing how your daily habits could contribute to. And as Bonnie said, we ultimately don't have all the control about whether our bodies will be attacked by cancer, breast cancer, or any other form. But what we can do and what we're responsible for doing once we know better is to do better by ourselves and to spread that education around prevention and all the preventative steps we can take in our daily life to lower our risk. It's all about lowering our risk, and with the diagnosis, surviving that risk and living to tell the story. So bless both of you for being here today and for the work that you do to help others become more aware and to protect their lives, of course. I do have a couple questions, and I know we're nearly at time, but I can't help but ask. We know, as we've talked over the course of the call in the beginning, that Black women are at higher risk. And we often hear the term triple negative breast cancer, a very aggressive form of breast cancer that uniquely impacts Black women. And we know that it attacks us at younger and younger ages.
Mm-hmm.
How do we need to speak to young Black women who are listening to this call or not listening to this call about the imperative to start earlier in understanding this disease and the risk that they need to be aware of? What is the message to young women? 25, there's someone on our call right now working on the background, my daughter, who is 27 years old. And maybe when young women hear the words breast cancer, they don't identify with that. Why is it crucial that we change that narrative?
Well, we can I speak to that?
Yes.
Yeah. In our support, we've been trying to figure out how to reach younger women, because younger women are being diagnosed earlier. At churches have programs. Unfortunately, people kind of reach out in October. October is Breast Cancer Awareness Month. But the reality is a woman can be diagnosed from January to December. So, what African American women should do, young women should do, first of all, make sure that they have an annual exam. It starts from there. And so many young women are healthy already and don't think they need that. They just go to the doctor when it's time to deliver a baby. You really should start at least about 18 having an annual exam. When you have that annual exam, routinely, you should be checking your breast. You should be checking your breast. If you go to your exam, have the nurse or someone show you how to do that. Sometimes we have to empower ourselves. We have to reach out ourselves, because we have young women who, and it's not their fault, it's just the way things are. But there are educational opportunities. You just have to look around for them. Churches, our organization, Nurse Affecting Change, we go to churches all the time. So somewhere along the line, some of these young ladies, I think, run into this, but stop ignoring it. stop ignoring. They have to stop ignoring it because it's so important. That you're right. Younger women are definitely being diagnosed with aggressive forms of breast cancer. And triple negative is really aggressive form of breast cancer. That's what they're finding. That 40% of triple negative breast cancer are young African American women. So we have to make sure that we're taking care of ourselves. So what we do when we go to churches, we make a point of reaching out and talking to younger women. It's because it's the younger women that are being diagnosed with these devastating diseases.
Absolutely. Gail, is there anything you'd like to add? And I have one caveat to add to that to you. The urgency of younger women beginning to pay attention to this disease, doing earlier assessments by age 25. These are some of the new guidelines. What else
Yes,
is on the
yeah.
forefront on new guidelines on screening and prevention?
Well, let me go back to our program because, in fact, what we say is that we will provide services to young women between the ages of 35 and 39 with symptoms. You know, when you hear a lot about the guidelines, it's 40, 45. When we first started the program, the big thing was 50 and older. Okay. And one of the things that has come up as a result of a lot more screening, and with a lot more screening, a lot other women have been diagnosed and they've been younger, that has brought a lot of attention to people. Couple things that I would add too is, it never hurts to just have a health education component as part of another program. One of the beautiful things about the Foundation for Black Women's Wellness is, you cover everything that we could imagine that is important to Black women, from health to well-being, finances, the whole nine yards. I know that in the African American community, we have sororities and other community organizations, and they are made up a lot of times of college age women, younger women. I encourage them, and this has happened to, have you thought about a breast cancer component as part of what you're doing? We are currently working with a small group of women who are part of the deaf and hard of hearing community. Again, we are working with them so that they get the message to women in that community about the importance of taking care of themselves. So, as Bonnie indicated, it's not just October. There are 12 months in a year. We have all kinds of programs going on. I encourage, even if you have what I'd like to call just a health moment, okay? Yeah. And again, one of the things that I get to do is not only work with Bonnie and Nurses Affecting Change, but we have a lot of program partners. People call me all the time, just like what happened here, and say, Gail, do you know someone that can come and, do that clinical education for us? So that's the other thing that we, who are part of the Wisconsin Well Woman Program, we can also, provide you with, some folks who would be more than willing to talk about the importance of breast health.
Thank you so much, Gail. There's so much more we can cover in this conversation. One thing I do want us to cover after I run through a few of the latest pointers on advice to Black women for prevention of this disease, I want to give Christine a moment to just share with everyone what the foundation does offer in terms of our programs across the board to support women struggling with diagnoses or the preventative end, of course, because that is key. But I want to just point out, here's what I pulled up just now during the course of this call. For Black women, it is recommended that we complete a risk assessment by age 25. We're advised to have a risk assessment to determine earlier if screening is necessary sooner. Start your annual screenings by age 40 as a preventative measure. All women should begin regular mammograms at age 40, although this can vary. But of course, starting earlier with mammograms may be advisable for women who have higher risk or family history, and to consider additional screening if your risk assessment identifies you as high risk. And of course, for some women, that means 25 or 30, you need to start doing mammograms. And all of us can do monthly breast self exams. And there have been times in the past where at our events we have discreetly partner with folks like the Carbone Cancer Center to help do interactive displays and activities on how to accurately and effectively conduct those breast self-exams. But that information is widely available online through a simple internet search as well. So there's many, many things that we can do. And one of those things that we can do is to call the Foundation for Black Women's Wellness and to take part in the many support services we offer. Christine, would you like to share a bit about that before we close?
Certainly. Thanks, Lisa. So first and foremost, with regards to breast cancer support, we have our Cancer Thrivers Circle. We meet virtually and sometimes in person right here on the green couch at the Foundation for Black Women's Wellness office space. And this is a space for women all across the country, regardless of your stage of cancer or type of cancer, to connect with those of us who have experienced cancer, who have been through the journey, or who may currently be going through the journey, because it's nothing like talking with someone, as Ms. Bonnie said, as everyone on the call has said, to talk with someone who understands it, who gets it, because sometimes our spouses and our friends, they just can't wrap their mind around what we're experiencing. So we want to be able to provide that safe space for you. We do meet monthly, but of course we are available throughout the month to talk through various conversations, various challenges that you may be having as well. From a preventive side, we have a couple of different options as well. We have our Walking Collective, which gets you not only moving physically, but also connecting with sisters. Because we know that social support and the lack of social isolation can really be a powerful preventative for several different conditions. We cannot operate in isolation. We do need community, and we are happy to provide that to you. We have about 12 different walks happening all across the country, all led by our health and wellness ambassadors. We also have Project Live Well, which we're coming to a close. We have a few, at the time of the recording, we have about 2 more classes left. So definitely go onto our website to check out what options are available to you. And again, most of our programming is done and offered hybrid. So that means in person and also virtual. So you can join us from all across the country.
And we hope that you all take advantage of those things, those who are listening to this. Community means everything, and sisterhood is healing. We have women of all walks of life who are facing many, many things, and the load is lighter when you carry it in a community of support and love. And that's what we aim to offer at the foundation. I want to give each of our amazing guests today the opportunity to give us a 15-second closeout of what final words would you leave to women and any community member who's listening to this on a playback about preventing breast cancer and securing our health and our lives. What would you say to them, Bonnie?
Okay. Well, what I would like to end with is sometimes women have changes in their bodies and they ignore them. So I would just like to quickly say some of the symptoms that you may experience if you do have a breast cancer. And one of them is a lump in your breast, under your arm, changes in the size of your breast if your breast begin to look a little funny, unexplained pain in your nipple or in your breast, skin changes, redness, dimpling of your breast. If you're not breastfeeding, you may have nipple discharge. Women want to make sure that they're paying attention to that and not ignoring it. So, because all too often women go into such late stage diagnosis of things that they have ignored for months. You want to make sure any changes in your breast, please notify your physician.
Absolutely. Know your body, study your body, be in tune
Yes.
with your body
Important.
always, and act quickly if anything is out of order, strange, painful, or just different. Act quickly.
Act quickly.
Monique.
Monique.
Okay, I had to come off mute. I would like to say, stay the course, like stay positive. I kind of feel like regardless of what the circumstances are, what God has in store for you, if we can just kind of embrace that and take some time for ourselves. And like she said, I found my own lump. They didn't find it, and I was getting yearly exams every year. And this was a month before I actually got my exam that I found my lump. And it was because of my self-exams that I found it. I also, they would have waited for me to go to the doctor, and they gave me like a lot of pushback because I did have a exam coming up already, but I had to go to another doctor, advocate for myself, and all of the things, jumping through the hoops to get assessed because I found something to be wrong with me. So be an advocate for yourself. Don't just walk away and because they tell you that they didn't find anything or they don't have availability or whatnot. Find somebody that'll take you and tell you something. Because by the time I did find it, it was stage 3. So it was imperative that they, started to take care of it right away. And I appreciate the fact that I was able to connect with a good team and they took, care of me right away and what have you. They was able to, like she said, they connected me with people that I could talk to, people that could support me on my journey. My doctors were very supportive, showing up to stuff outside of my doctor's appointments where I was working out and, trying to do things to stay healthy. And that's how they were like encouraging me. Like, I'll go along the side of you and things like that. So it helps to have a support person like Miss Bonnie was speaking about.
Absolutely. Thank you so much, Monique. Just reiterating that self-exams work. They are the first thing that we can do for ourselves on a regular basis as often as we need to, and self-advocacy is crucial, is absolutely crucial. Gail.
I can't say enough again about connecting with the health education resources in the community. But the other thing that I always stress, because again, everybody doesn't have insurance, everyone's not wealthy. I cannot say enough. If you are uninsured, please contact the Wisconsin Well Woman Program. Remember, we are in every county in Wisconsin. Okay, we are a statewide program. One of the things that we have heard over the years is, as Monique pointed out, I found a lump, but I don't have any way to go in to see a healthcare provider. That's where we come in. So don't forget about us again. Even if you don't need us, if you have friends or family members who need us, let them know. Contact the Wisconsin Well Woman Program.
Thank you so much, Gail. And you heard that. Follow those instructions. And we are just grateful for all of you for being with us today. And we want folks who are listening to know that this circle is a reminder that breast cancer awareness isn't just about wearing pink. It's about our understanding of the resources for prevention, for saving and protecting our lives, knowing our family history, establishing relationships with our providers, advocating for ourselves, and the collective power we have in sisterhood to hold one another up and to support one another through the journeys. Huge thank you to our panelists today for leading and shaping this much needed conversation today to empower and encourage everyone listening. And we hope that this recording goes far and wide. And we ask everyone who's viewing it to share it with at least one other person, if not more, to every woman in your family, to every woman in your network, and to your partner, and to the men and others who support us in our lives, because education is power and we all need to be equipped with that. And lastly, before we leave, I want to say these parting words: know thyself, love thyself, heal thyself. Our wellness starts with us, and we have the power. With that, remember to be safe, be healthy, and to be well. And we will see you very soon. Thank you all for listening.